Hi, my name is Marcos Restrepo. I'm a reporter with the Florida Independent. I've been reporting on the situation with HIV and AIDS here in Florida for almost this whole year, and we're going to have a short conversation today. I want to introduce my co-reporter from up in Michigan.
Hi, I'm Todd Heywood. I'm the senior reporter at the Michigan Messenger. I've been reporting on HIV and HIV criminalization issues since 2009. And so, Marcos, what we wanted to talk about is Florida has the largest HIV waiting list for drugs, the AIDS Drug Assistance Program. Can you update us where we're at on that, and what's the holdup? Why aren't people getting those medications?
Sure thing. As Todd said, it's the AIDS Drug Assistance Program. It's federally funded, but it also receives state funds, a different amount in each state. Since halfway through 2010, there was a funding crisis. It was called a perfect storm. Too many people coming into the AIDS Drug Assistance Program system, so they created cost containment measures. One of those measures is a waiting list. That means that you're waiting to get your medication, your HIV/AIDS treatment. Okay, the total number is somewhat over 6,500 in 12 states, I believe, as of earlier in November of this year. Florida accounts for 50% of those, and the number was somewhere over 3,200. Again, earlier this month. Why has that number skyrocketed? Well, in Florida, there were, again, the perfect storm reasons. We had too many people coming into the system. Federal flat funding, that means not enough money was coming in. The state wasn't procuring enough money for the program to function correctly. So you had the situation where you had too many people and not enough medication. So they created the waiting list. It's been there since June of 2010 in Florida. The numbers have been going down over the last 2 months. We peaked at over 4,500 back in September, in early September, and there's been a steady drop.
How much of that drop is the result of the Obama administration releasing $50 million for emergency ADAP monies?
Well, basically, that's the reason why it's dropped. Okay, sources here in Florida and South Florida tell me that we received about $7 million in funding from that what you just mentioned through the Obama administration. So that helped put money into the system, take people off the list. But sources also tell me that that's going to be short-lived. That as we move closer to fiscal year 2012, somewhere around, well, next year, we're going to see a slow increase in the numbers of people on the ADAP, waiting list. And ADAP, by the way, that's the way the AIDS Drug Assistance Program is usually known. So what I want to get back to you, Todd, is you were in the Chicago U.S. AIDS Conference just last week. So I want you to talk to us a little bit about an overall view of the conference and what issues stand out in terms of treatment, prevention. They're really important for folks down here in Florida.
Sure. I think the biggest thing that comes out of the conference, and this has been something that's been building this year, is HIV treatment as prevention. As you know, when people are on these medications, it reduces their viral load, and the reduction of viral load makes them not only less infectious, but also makes them healthier. The problem that we have there's sort of two layers of problems that are involved here. One is, obviously, with ADAP waiting lists, we're going to identify more people with HIV and who need treatment, but they're not going to have access to medications, and that's a real concern. The second issue is that currently in medical circles, it's not we don't teach each other as Americans how to challenge doctors and ask questions. And so as a result, people who may not need to go on the medications, and that would be people with CD4 counts of over 500, may be talked into going onto these expensive and toxic drugs because their doctor said this is what you need to do, even though there's no scientific evidence to back it up. So there are some ethical considerations that are starting to arise out of this. We're also aware, under the National HIV/AIDS strategy, the federal government has begun mandating that states collect viral load tests and CD4-CD8 ratio tests. The CD4-CD8 measures the immune function of the body. And what we're starting to hear anecdotally now from different states around the country is that some people who are testing with an elevated viral load, public health officials are coming and knocking on their door and sort of playing Big Brother to demand to know why their viral load is up and they're not on medication. And that could raise some real concerns as well. So on the one hand, it's great because we do know that effective treatment prevents new transmissions. But at the same time, we do have some real concerns involved in this in terms of the ethical issues that might arise from it.
Okay.
Does that make sense?
Yeah, I was talking over the weekend, specifically on Sunday, with a source down here in Florida, precisely about this high-impact treatment that would focus on folks who are already positive, right? And one of the things that he mentioned is, yes, that's an interesting measure, but it's also worrisome, and he's been dedicated for at least 20 years to prevention, HIV/AIDS prevention programs. Told me that take the focus off people who are HIV negative, okay, but whose behavior puts them at risk for getting infected, is risky. He's worried. He's worried about that. Did you hear any more comments around that up there in the conference?
There wasn't a lot of conversation about that at the conference, but we do know that the Centers for Disease Control has announced that it's going to shift its funding structure away from traditional negative communities and at-risk populations into the prevention for positives messaging. And when I did some reporting on this back in June, I was told by CDC officials that the reason for that is because it's easier to reach 1.1 million people than it is to reach the entire American population. And that's really kind of a short-sighted vision when we have a CDC statement that everybody should be tested ages 13 to 64. The American Academy of Pediatrics has just come out and said that all teenagers should now be tested annually for HIV, whether they admit to sexual and drug behavior or not. So the messaging, if we're not sending the message out that even though you think you're negative, you need to get tested, then we're still going to miss a huge chunk of people. Remember, 1 in 4 people infected with this virus in the United States don't even know that they have the virus. And those people are the ones who are most responsible for new infections. Depending on which study you look at, you're looking at 70 to 90% of new infections are caused by that 25% of people who don't know their infection status.
Yeah, and Florida has among the highest numbers, right, in the U.S.
We're seeing, the South has become a huge problem. They have a massive problem with the epidemic. And part of that is because they have not invested in the infrastructure in the health system. And part of that also deals with the fact that you have large African-American communities that have not talked about the epidemic and have not talked about men who have sex with men. And so we're seeing explosions down there. And there's so much stigma attached to being HIV positive that nobody's talking about it. And so the South, that's part of the reason why the funding structures have been changed for HIV prevention and HIV treatment under Ryan White, is because it used to be based on cumulative number of cases of AIDS. So places like Florida and New York, which have seen declining numbers, were still getting tons of money, even though they had less people living with HIV than places like Alabama and Mississippi and Florida, where the epidemic has exploded and they don't get the money for it because those numbers don't match the cumulative totals in New York or California. Of course, that raises all kinds of other issues as well.
Yeah, so the shift is going to be now on incidence, yes?
Yes, it's going to be on the current incidence, not the cumulative incidence, which is good on the one hand, but there are some significant worries, I think, about the shift away from traditional prevention messaging, as well as this move to this test and treat, which also raises questions. How are you going to do HIV testing and then linkage to care if you don't have a system in place that's encouraging people who are at risk to get tested? The Prevention for Positives program only focuses on people who know their status.
Right.
So how are we going to get people to know their status is the concern that I see with this, and I've heard from a lot of HIV specialists on that concern as well.
Yeah, I think that in the coming months, that's one of the issues we're going to be reporting on. prevention programs down here, especially in South Florida, because the bulk of cases are spread out in 3 counties in South Florida: Palm Beach, Broward, and Miami-Dade counties. The problems surrounding incidents is another issue we're going to be reporting on, and definitely stigma. I remember I interviewed a gentleman from Atlanta earlier this year, in January of this year, African American. He was HIV positive himself, and we spoke, or he spoke, mostly about the problems surrounding prevention programs in Atlanta, right? That he called a sophisticated city, yes? Okay, but
Yeah.
there's still a lot of stigma, a lot of shame, a lot of anger, and this stops people from doing what you were talking about, right? It
Oh,
does
absolutely.
not help people to come out and get tested and accept, that they've been at risk and they could be a risk to others. So those are issues we're going to be reporting on from down here. I don't have very much anything else to add, Todd. If you want to wrap it up.
I think that we've started the conversation, which I think is great, and I think the more coverage that we do on these issues, the more we can help inform our readers and hopefully help push an agenda so that we can help end the AIDS crisis, which is part of what we need to do. So until next time, I'm Todd Heywood from the Michigan Messenger.
And Marcos Restrepo from the Florida Independent. Take care, everybody.
Take care.